Welcome to Healing with Zen, a space where we can deep dive into Chinese medicine and acupuncture and talk about how it can benefit everyday people like you. In my 15 plus years of practicing Chinese medicine, I've been noticing that autoimmune issues have become more and more diagnosed on a daily basis. My name is Zen Tuan. I'm a licensed acupuncturist, herbalist, and founder of Healing with Zen. Our physical practice is located in Pasadena, California. And today I'm super excited to invite Dr. Kira Lane from Healing with Zen, who specializes in autoimmune, to discuss the top myths about autoimmune diseases and give us some practical tips that we can use at home today. So hi, Dr. Kira. Thank you for being here.
Yes.
So first off, autoimmune is a topic that is becoming more and more prevalent. I hear that term a lot more. Can you tell us a little bit just about what is autoimmunity? What's an autoimmune disease?
Sure. They think that there's about 80 to 100 plus different autoimmune conditions. So they range in what kind of symptoms you can have. Some people describe autoimmunity as a breakdown of tolerance. Some people describe it as your body attacking itself. I don't love that one. I like to think of it as kind of a breakdown of self, and everything that you're trying to do outside of your autoimmune condition to kind of help yourself and help yourself heal is more of a coming back to yourself and trying to find yourself again. But yeah, at its basic terms, you have some imbalance in your immune system. So it doesn't necessarily mean that your immune system is not functioning. It actually means that it's over-functioning. And yeah, it's not something that cannot be mitigated.
And what can this present as? I know you said that there's a lot of different kinds of autoimmune diseases, but what does it really look like for somebody who is diagnosed with an autoimmune disease?
Yeah, so there are common signs and symptoms, but again, it is going to differ. So let's say you have RA, you're obviously going to have those swollen, tender joints, and that's specific mostly for RA or something like psoriatic arthritis. But then overall, people with autoimmunity tend to have like brain fog, fatigue, overall just like aches and pains.
A lot of symptoms that we see at the office, right?
Yes.
Very common symptoms that people may not even know that could be from an autoimmune issue.
Yes.
And so how are people usually diagnosed with an autoimmune disorder?
Yeah, it takes years usually. It's not overnight because usually these signs and symptoms are kind of just infiltrating your life and you don't even realize they're really coming on, and then all of a sudden you wake up and you have maybe 5 or 10 of them, and then you're like, okay, let me go get checked for something. And then you most likely will have blood tests, and they'll be checking for different markers to see if you have inflammatory markers. And they don't always come back as positive, so it is hard sometimes to diagnose autoimmunity. But it can be a process that takes up to 10 years for people to really get the diagnosis. You have blank autoimmune condition.
Which can be so frustrating sometimes, right? Because you're going back and forth with all these symptoms and there's no real diagnosis.
Yeah.
So I guess if somebody were to be diagnosed with an autoimmune disease, what would be the top myths that we can bust right now about autoimmunity?
Yes. So for myths, I think a lot of times when people hear you have RA, you have Hashimoto's, it does feel, although you have the answer of, okay, I now know I have this condition, which can help, right, to have a diagnosis of something, you also kind of feel like you have no power, because if you look up autoimmunity, a lot of times it will say there's no cure. So it feels very finite and, oh my gosh, I have this disease and what am I going to do about it? So I like to tell patients that you have a lot of power in helping to mitigate autoimmunity and also how it manifests for you. You have a lot of power in that. So that's myth number one, I would say. Also, some people think, okay, well, my signs and symptoms are improving, so that must mean I'm cured, I have no autoimmunity. Right. No, unfortunately, it's something that you're gonna kind of have to think about forever. That doesn't mean that it has to be as first and foremost of your day as it is right now. but just to keep it in mind with your lifestyle factors and any other environmental factors, that is something you're gonna have to think about forever. There are sometimes, also I just mentioned this before, but with labs, they're not always gonna come back positive for, inflammatory markers such as like CRP or ESR. Those usually will come back positive, just because they're broad inflammatory markers. But in terms of like specifics, so like RA or like RF and those type of markers, they're not always going to come back positive, but that doesn't mean that there's not something real going on. So don't let labs alone make you feel like that's kind of
the
how
concrete evidence.
What you're feeling is real, regardless of what your labs come back as. And then also, a lot of times I see this, at least with my patients, is they'll come in and they're like, I have all these signs and symptoms and I've been to so many practitioners and they just can't figure out what it is. And people start to think that they're going crazy, but that's not the case. Especially within TCM, we look at you so broadly as a human and what you've had to deal with throughout your entire life, that we look at it more as, okay, let's try to piece together all these signs and symptoms, and not just look at, oh, okay, well, these don't make sense together, so we're just gonna look at them separately. So yeah, you're not crazy, and what you're feeling is real, and a lot of other people experience things like that as well.
I think those are great myths to talk about and let people know that they're not alone, and that it takes time for diagnosis to properly be diagnosed sometimes, right?
Yeah.
And so that brings us to the next point. You said TCM, which stands for Traditional Chinese Medicine, and that's what we do. We're Chinese medicine doctors. How is it that we can help anybody that is diagnosed with autoimmune disease or has just the signs and symptoms, hasn't had the diagnosis, but still feels that they're off?
Yeah, so a lot of our modalities, like I said, focus on the whole person. So the first one that comes to mind for me is obviously acupuncture, because that's what we love to do here. But acupuncture has a whole slew of positive effects in the body, and the way we describe acupuncture is more, people think it's like a little esoteric and woo-woo, but there are a lot of scientific benefits to it. So I like to tell people that it's releasing endogenous opioids, so those are your natural painkillers. It's also decreasing the pain response within the brain, so that's helpful as well. And then at the site of insertion, there's a lot of anti-inflammatory as well as inflammatory chemicals that your body naturally makes that are released. And your body kind of sees those as, okay, there's a little bit of inflammation, so let's put out an anti-inflammatory blanket all over the body, and that's kind of how it works to create an anti-inflammatory effect overall. Of course, you have increased blood flow, increased lymph flow, which is great, especially for if you have any aches and pains in the body. That's amazing to have that increased blood flow, and it also helps to bring all those white blood cells to that area as well, and hopefully clean up some of the debris from the inflammation.
And the most simple way I put it, because most patients always say, oh, I feel so good after my acupuncture, is because we're releasing all the feel-good hormones. And so naturally you just feel more calm, relaxed, and you feel good. You feel like you're floating.
Yeah, it's the serotonin and dopamine that are released make you feel just, like you're floating out of the office, which we hear often. Yeah.
So you mentioned the acupuncture for autoimmunity. Do you like to recommend any other types of things for patients? Or if they're scared of the acupuncture, which some people are, how else can we use traditional Chinese medicine to help?
Yeah, so another great way to go through TCM treatment would be herbs. It's harder to talk about herbs in a broad sense, only because it is so specific for you and the symptoms that you're currently going through. I try to think of herbs in a way of like a specialized medicine. So instead of, like sometimes you'll go obviously to a doctor, and they'll give you, okay, well, this is first line of treatment, second line of treatment, whatever. And we like to think about it more as like what's first line for you specifically. So at least here at Healing with Zen, we always do individualized formulas. We don't use formulas that are already in a bottle. All of them are custom.
We like to customize it so that you get the exact herbal dosages in the right formula and combinations, so that you get the best effect.
Yeah.
Right? So on that note, if they're not using acupuncture or herbs, are there any other tips, daily tips that we can offer people who have just been diagnosed with autoimmune, or maybe their friends or family are dealing with this lifelong problem? What else can we do to help?
Yeah, so there are things that I think everyone should try to incorporate into their life, especially just to stay well and healthy. But I think these are also extremely important for people that deal with chronic conditions. So the first thing would be no direct air conditioning. We're in Los Angeles, so it's hot a lot of the year. And direct AC is something that we talk about all the time. We try not to do it on the face especially, or on the neck. That creates what's known as wind in TCM, and that can almost push pathogens into your body in a way that you don't want to. It also just causes like muscle tension, so it's uncomfortable. So that would be the first one, no direct AC contact. If you're in your car, just move the vents away, you'll still get cool. So that's one. Two, I would say to keep your feet warm as much as you possibly
That's
can.
a good one.
There is fascia that covers all your muscles in your body, and your feet are connected to your neck and your head through that fascia. So being able to keep your feet warm kind of keeps the circulation going, especially if you have like cold feet, poor circulation. They get kind of purplish. We don't like that. So keep those feet warm and get the blood pumping throughout your body. That will help with aches and pains as well. This one is hard for me even, but I try to tell people to do it if you can. Getting sunlight directly through your eyes outside if possible within 2 to 3 hours of sunrise. Do it as much as you can. This helps obviously with circadian rhythm and resetting that, but also it's important for your gut, which I don't know if a lot of people know, but your gut actually changes based on light. So it can help with digestive disorders or gut dysbiosis, things like that.
So fascinating. The body's amazing.
It is amazing, yeah. Going back to what we did, hundreds, thousands of years ago is always probably a good bet if you're trying to think of things to do. Also, natural forms of light around bedtime, that's great. So maybe instead of a lamp with a normal light bulb, maybe you do like a salt lamp, so it's a little bit more calming. Definitely no blue light on the phone.
Yes,
We
that's a
don't
big
want
one that we talk about, right?
Yeah.
Or at least get the blue light filter glasses.
That just helps with appetite actually, so the next day it can help decrease appetite. So if you feel like you wake up and the whole day you're just ravenous, or you had poor
That means you have too much blue light?
Yeah, at night it can affect how you feel the next day in terms of and also just affects your sleep. And then if you don't sleep great, then you end up being more hungry too. So for appetite regulation, I always say like stay off TV, laptop, phone.
Like an hour to two before bedtime,
At least an hour. If you could do 2, I know two's hard, but at least 1 would be great. So that's number 4. Also, I am a huge proponent of sweating. If you can sweat every day, that would be great. There are some doctors who say that it's not a big detox pathway, it's not that important, but I do notice a lot of my chronic condition patients, they don't actually sweat, like they have a tough time sweating, which I find interesting. We have our own ways of looking at that from TCM, but I always just think of dampness, and I think of like gut dysbiosis, I think of biofilms. So sweating and kind of pushing those pathogens out is the best thing you can do for yourself. So it doesn't have to be like dripping sweat, but at least just like damp, you know, like little clammy.
Movement is always good. So
Movement,
it could be
yes.
exercise, you could do steam rooms, sauna.
Sauna's perfect.
What do you think about being outside in the sun?
Yeah, there you go. That's how there you go. It's perfect. Mm-hmm.
Well, on that note, thank you for those practical tips. I think those are really good tips rooted in Chinese medicine, philosophy, and theories. Could you give us a case study or example of how acupuncture with all these tips have helped one of your autoimmune patients?
Sure, yeah. So I'm gonna read off here because there was pain scales and all the things. But I had this patient who actually told me that she had 12 out of 10 pain, which must be pretty severe if someone's going over 10. Usually people don't even reach 10 when they see me. So she was diagnosed with Hashimoto's, RA, and fibromyalgia. So there was a lot going on. And she mostly had this pain in her neck, ankles, and wrists. She also had 10 out of 10 fatigue. She just like could not get out of bed.
That's probably the thyroid.
Yeah, definitely. That and the fibro for sure. And she had a lot of depressive thoughts. It was just a cycle of not feeling well. She also had this very uncomfortable edema that would happen, especially in her lower limbs, but it really was everywhere. And it just felt like she was about to burst all the time. So she had a lot of things that were making her very uncomfortable, and it was really hard to work, and she had kids, and that was really hard to take care of them. So after one treatment, and I did acupuncture, and I did some e-stim on her as well. She had her own herbs, so she was taking herbs as well. So it was acupuncture, herbs, and a little bit of e-stim. She noticed noticeably more energy, not necessarily right after treatment, but it started picking up each day after treatment, and then she really noticed the increase in energy on day 3 after treatment. Her pain went from a 12 out of 10, which is like even hard to measure really, to 8 out of 10.
That's great.
Which is still high, but it's definitely better than 12. And that was also around the same time, so it was like kind of a gradual process, which is why I like to tell patients too, like if they feel kind of tired after treatment or they don't feel immediate effects, that doesn't mean that it's not working. It's taking its time, because we aren't putting anything artificial into the body, we're just letting it heal itself. So sometimes there can be a little bit of a delayed reaction, and that's completely normal. And I see that often, I'm sure you do too, where it just takes a few days. And what I really loved about this treatment is that within the week, she noticed so much less of that like tightness and edema, and she thought that that was like the most relief out of anything. Like that was what brought her the most relief, just because feeling like your skin's about to pop all the time is just not very comfortable. So yeah, I loved that case. I continued to see her after that, but I like noting the changes that she felt within a week.
And it's interesting to note, because a lot of times people do acupuncture and they think it's for pain relief, right? But it can be used for so many other things, like swelling. Edema means swelling, right? Swelling in the ankles and the joints, or for fatigue, or for sleep, or digestion, or even just balancing out the immune system when it's off, like having an autoimmune disorder. So thank you for that story. I think that was very insightful. We do hear a lot about gut. You did mention something about gut. Why is gut health so important when we talk about autoimmune issues?
Yeah, so the gut is, they say like 70% of your immune system is in your gut. We all know about the gut-brain axis, how that works as well, or at least it's connected, we now know. But when you take in food, it's going through a little tube in your body. It is not in your body yet, it's actually external technically. So it's going through your body, and then it's getting down to the small intestine, where then it can finally be absorbed into the bloodstream.
Mm-hmm.
But sometimes if you have gut dysbiosis, which just means you have a lot of bad bacteria and it's an imbalance of bad and good bacteria, or you have a lot of biofilms, like this sticky thing that bad bacteria love to stick in and like kind of cover themselves to keep themselves safe in your body. If you have that, if you have leaky gut, so that those things can contribute to leaky gut, or other like pesticides, things like that, like chemicals in food. All this over time, those little junctions that help to keep bad things out of your bloodstream as you're digesting food, they start to break open a little bit. So now you might be able to get like toxins from your food, like
Directly
directly into your bloodstream. And then your body is like, well, I don't like that, so I have to attack that. I don't like it. So if you're prone to an autoimmune condition, like if you have, you know, one of the changes in your genetic makeup, or if you already have been diagnosed with one, that's one way to just like keep your immune system firing. And it's one of the things we try to mitigate first and foremost, is to help your body kind of calm down a little bit, especially when it comes to what you're
So you're saying that we should treat the gut if there's autoimmune.
Yeah.
And even just to continue to make sure your gut is functioning well so that you can prevent the autoimmune symptoms from showing up.
Yeah,
Mm-hmm.
totally. And I like to say too, like, have fun with your food. It doesn't have to be so like scary to eat healthy. And I know like garlic tastes great. So
I love
hopefully
garlic.
You like garlic.
I put it in everything.
But it's super antibiotic. Me too.
Yeah, it's
I love
actually
it.
very good
Yeah,
for you,
it's
for your
super
gut.
good for you. It's also like that same thing of like pushing out, like it has like an acrid sort of quality, so that can be great too. But it's very healing for the gut and for the body. So just add in stuff to your food. Just add in herbs, add in like actual garlic. Don't just buy like the minced stuff, but like cut it yourself. Cut up some lemons. Always add lemons to things. But yeah, just try to have fun with what you're eating. You know, just make it
Yeah,
fun.
I love that.
Yeah.
I love that. Being healthy doesn't have to be so strict or so scary, right?
Yeah.
So talking about the gut is really interesting because I went down this rabbit hole myself. I was diagnosed with thyroid autoimmune disease when I was during my last pregnancy, my third pregnancy. And so I decided to run the gut test on myself, which you do a stool test at home. It's really interesting. You never thought that you would collect your own poop, but you do, and you send it into the lab. It's actually quite easy. And they came back with all kinds of stuff. You know, they tested for parasites, they tested for candida, all kinds of bacteria, viruses, and parasites as well. And so what showed up for me that was interesting was they also said that I had mold exposure. So I actually went down this research learning that mold has a lot to do with autoimmune as well. Do you know anything about that?
Yeah, so I get that question too sometimes. People are like, I hear about mold and parasites, but I don't know if that's actually a real thing. Like, should I be worried about that? And I would say, I mean, you don't have to be worried to, you know, some crazy extent, but yes, those are both things that your body doesn't like. So they are going to manifest as symptoms, especially if you're sensitized to external chemicals and stuff, if you're like a sensitive person. And with parasitic infections, they're very interesting. They sometimes will actually mimic an autoimmune condition. So maybe you don't even have an autoimmune condition, maybe it is a parasite.
That's fascinating.
Yeah, so they have signs and symptoms of, again, like fatigue, brain fog, numbness and tingling randomly in different parts of your body. Usually it'll come and go. Trouble sleeping, grinding your teeth at night. So I don't want to like scare anyone because I know a lot of people grind their teeth, but it's like with everything else, that's kind of a common symptom is you wake up and your jaw is basically like glued shut because you've been grinding so hard.
Are there ways to get rid of the parasites easily?
Yeah, so you definitely have to know if you have one. So like Zen was saying, you have to do a test. I wouldn't just go, okay, well I have brain fog and brain must have them. Yeah, don't do any of that, but definitely do a stool test at home first and foremost, so you know exactly what the parasite is, because there's different parasites, so it's not just one and done. And then you can go to an MD and they can give you medication to get rid of it. That's number one. And then from a TCM perspective, we have herbs that are anti-parasitic that we could use. There's also, like, some home remedies have clove. Clove is like a known one that can be anti-parasitic. So there's different avenues you can go down once we know definitively that you have a parasite. That's one of those things where testing is pretty important to know if you actually have one or not. And then with mold exposure, especially if you live in a colder, damp environment, basically if you have seasons and you live in a humid environment, and even here in California, I mean, we say it's dry, but it's not that dry.
You still hear a lot of people have mold exposure,
especially
even in their
near
homes.
the ocean and stuff. Yeah. So I have some suggestions here for mitigating mold in your space, and these aren't things that you have to do just if you know that you have mold, but also just for anyone. These are just things that I do, and I don't have mold in my space because I've tested for it, but I just do these things just as good practice. So if you have a dehumidifier, great. That's number one. You want to try to get your humidity in your home down to about 50. 50 would be good. If you do 60, that's fine too, but definitely don't want it to be over that. Also, leave your windows open as much as you can.
Yeah, I love that one.
I always leave them open.
I try to open them every day.
Yes.
Yeah.
And I get it because, like, here it's obviously easier to leave them open because it's good weather most of the year. But even if you live, like, I'm from New York and I used to leave them open, so you can do it. Even though it's cold, I know, just crack them.
A little crack.
Just crack them.
And it doesn't have to be all day.
No,
right?
but just like for, a few hours, just leave it cracked. Also, leave your closet doors open. So, especially when you're not home, because a lot of the mold will hide in your closets, in those little corners. And we tend to close our closets or just leave them closed all the time, and that's like a breeding ground for mold because it's so dark in there, and then all the dampness is in there as well.
I'm learning too.
It's like a little hot box, you know? So leave the doors open if you can. That would be great. And also, this is kind of a weird one, but you know when you're cooking and you're putting your spices in your pan and all the steam is going back into the jar, then you close it. And spices love mold. I don't know why. Not all of them, because some of them actually like kind of propel the mold, but yeah, like if you're shaking it over your pan, try to just shake it either in your hand and then put it in the pan, or like shake it in a separate dish and then put them all in, or at least let them air out after. Don't close them right away. But yeah, that's one sneaky way, because a lot of people don't even throw out their spices, including myself. Like, I know we're supposed to turn them over for years.
Like for years, yeah.
And do that too. Get rid of your spices after.
Get new ones.
Yeah. And then also, one that is very prevalent nowadays, because a lot of us have those like big hydro jug Stanley things, clean out your straws.
Yes.
That's a big one. Did that once and I was disgusted. So I now am like anal about it. I try to do that every day. I try to clean it out because you don't realize like that's just sitting in water, and especially if you're in like a warmer environment, a lot of things can get in there. So use one of those straw cleaners and make sure it's cleaned out.
Is there anything else in regards to autoimmune that you want the general public to know? That maybe I missed about asking you, or even if you want to talk a little bit about the mind-body connection, because at Healing with Zen, the acupuncture and the herbs really work on a deeper level too. Like, yes, we're treating your signs and symptoms, yes, we're working on your immune system, but we get to a lot more emotions as well, right?
Yeah, so I mentioned in the beginning, but I really like to think of autoimmunity as rediscovering yourself, because it's just a misguided response in your body. It's not necessarily bad, or your body's not betraying you, it's not trying to. You're just trying to rediscover yourself. So all of these tips and tricks that you can do, and like coming in to see us, are great, But at the end of the day, there is a mental component to it, especially if you've been through some trauma that maybe caused the autoimmune condition or was part of it, not necessarily caused. It's great to work on that, so it doesn't necessarily have to be with a therapist or anything like that, but even just journaling out your thoughts so they're not racing throughout your head constantly. We see a lot of worry in our patients as well, especially with, just life in general. It can be a lot to take in. So being able to release those thoughts, I think, is a great way to do that. And also just, what did you do as a child? Like, I always like to think about that. What did you like to do? And can you do any more of that? Like, I really liked to skip as a kid. I actually won an award for it.
For skipping?
Yes.
Like skipping the longest or the most?
Yeah, well, it was in like preschool or something. But I won an award for it, best skipper. So now, like, me and my fiance will try to just like skip when we're out and about because it's fun.
I love that.
And we get to like laugh and it's just funny. So try to think about what you like to do as a kid. Like, were you a painter? Did you like to paint or whatever? Did you like to dig in the dirt? Do that. But try to rediscover things about yourself that you really love and that you really connected to and made you feel at home and safe. And try to feel safe within your body if you can, and figure out what those things are for you.
No, I really love that because when I was diagnosed, I went through a lot of those emotions that you talked about, just feeling confused and not in control, right? Yeah. And so I think it is important to realize that this is not just a diagnosis. It's really a lifestyle change. Like, how do you want to live your life to feel your best, right? And it's like a choice that you make. Like, I want to continue feeling good, so I'm going to make these choices. Well, thank you so much, you guys, for tuning in. Thank you, Dr. Kiara, for being here and giving us all those amazing tips that we can use right away. If you haven't yet, please follow us and subscribe to our channel. We love to give holistic tips that you can use for all kinds of health conditions that we see at the office. Our next podcast is going to be about fertility, so please tune into that. And we look forward to seeing you next time. Bye.
Bye.